Hello everyone, Mark Hackle, Macomb County Executive, John Paul Rea. This is kind of our first, if you will, update of the year 2021.
That's correct.
I don't know about you, but I'm glad it's here. So
Starting off on a fresh foot.
Glad that other one is behind us, but again, we know that it's not just really behind us. There's still kind of a transition going through this COVID concerns and what's going on economically, but we see some good things that are coming our way. So we're fortunate. The county's in pretty good shape. We just kind of feel for a lot of those businesses. We're still trying to figure out how do we work with them. We still encourage people shopping local, and we know the Christmas season holidays are over, but you still got to help out these businesses, specifically our restaurants here in Macomb County. Get that carry out, kind of help them out a little bit. So we're glad to be in the new year.
Yeah, Mark, it's one of those things as we get through the holiday season, tremendous amount of cheer and goodwill that goes throughout that season. And I think everyone's got a deep breath heading into 2021. As you said, a number of COVID challenges still following us into this year. But I think as we've illustrated throughout these video updates and with the county's operations, whether it's our testing site, whether it's our vaccination site, whether it's our community outreach, whether it's our business engagement, we're here to serve the community, and all those resources are available at macombgov.org. So again, credit to the team, credit to the messaging, and credit to our ability to continually rise to the challenge and be a part of that solution.
And the health department hasn't skipped a beat. I
Yep.
mean, anybody who needed testing, we were providing that testing. Again, we know there are other locations throughout the entire county, throughout the state, if you will, that testing is available. The folks that have been doing it for us, and obviously now we're using the Baker College site on Gratiot, just south of 15 Mile Road. People want to get tested, they can get tested. There really hasn't been a pent-up demand that we haven't been able to fulfill. And now that we're into this new phase of vaccination, that has become the new question or concern, and a lot of questions about that. We're trying to get people information as we get it. So again, I remind everyone, we are guided by what comes our way from the federal government as well as the state. Right now we're in that phase 1A, and the phase 1A, simply put, are for people that are in the healthcare industry. The folks that are, we're looking at right now that are licensed EMTs, and our health department has been able to provide that. And so we're keeping up direct contact with those that are emergency, if you will, paramedics here in Macomb County, working directly with them, working with our healthcare officials, and some of the other congregative care facilities. So that contact is there. It's not open up to just everyone or anyone from the general public. It's very specific what 1A is. We're meeting that demand, and we're doing about now we can ramp up to do about 1,000, 2,000 people a day from just Macomb County's health department. But we know that once they open up phase 1B, there's going to be a lot more that we're going to be able to do there.
Mark, strategy is already in place actually as we're having these discussions right now. Our health department, along with our incident command folks and our emergency management personnel, are talking about how we begin to prepare for that next phase. We have strategies already in place. We've got staffing, we got contracting agencies, we got our staff within the health department, we got other folks that are on board. We're prepared. It's one of those things that is, again, when we understand what the state's expectations are as far as that gating criteria, when we can move into that next phase, and as we've always said, what is the way that we're going to connect with those people? Using these forums here with the videos, obviously through macombgov.org, and then using all those agencies that are on the regulatory side. So as whether it's police and fire, whether it's those that are on the healthcare side, how we continue those conversations, actively engage those folks so we know how to get those people in and out as quickly and as efficiently as possible.
Yeah, and so the next phase we understand is going to be the critical or essential workers, along with people that are 75 years of age or older. That's at phase 1B. As JP mentioned, we're preparing for that because that's going to be the bigger, I guess, if you will, demand that we're going to see. And the questioning is to, okay, what constitutes somebody that's actually part of that category?
Yeah.
We know what 75 and older is, but the question is going to be out there is to, who is a critical worker? Who are those folks that we're targeting, and how do we do that? In our opinion, we truly believe that people that are 60 years of age or older should be the ones that are stepping up in the front of the line and providing that vaccination for if and when we get more vaccination. Right now we're asking about 1,000, if you will, doses a week. We're getting that, fortunately, from the state, but we think we can ask for more than that. We think we can probably get about 10,000 a week if and when that time comes, they open up 1A. We're going to be making that request, but it can't just be health departments throughout the state that are doing this. We need the support of, obviously, the pharmacies, like they do with normal flu shots. They got to be part of the solution as well. Even some of these urgent care facilities, we're hoping, doctors' offices. So we're hoping, much like we do with other vaccinations and flu shots, if you will, that they're going to be part of the solution as well, because once they open up phase 1B, there's going to be a bigger demand for people wanting to get vaccinated, and that needs to be part of the strategy moving forward, not just health departments. So we do believe not only can we ramp up our facility
Absolutely.
here and do about 3,000, maybe 4,000 a day, that's still underserving the population. We do believe that we have other opportunities to work with our health department and even kind of bump that up by going to locations and having it staffed to an extent that we need to. But we have to rely upon, obviously, urgent care. We need the health industry as part of the solution. And as I mentioned, even the pharmacies to be part of this, as well as our doctors' offices.
We've talked about it time and time again on these updates, is having that partnership-driven model. We know from a public health standpoint, we have the capacity to serve those individuals up into the 4,000 on a daily basis when we get to that full capacity mark, when we have the inventory that we need as far as the vaccines, and when the state and our federal partners open up that next phasing criteria. The question is that when we begin to phase in the rest of those partners, as more vaccines become available through our state and federal partners, as they go through the certification process to get and assist on those end, and as you said, as we get a bit more nimble with our operations. We want to make sure that as folks come to the Vacuum building, first and foremost, we service all those people as effectively and efficiently as possible, but we also know that there are more nimble strategies that we can deploy, whether it's using fire stations, whether it's using community sites. Those are things that are already in the mix, are already in the conversation, and we're already working with our community partners to vet the credibility of those sites.
And the folks from the health department, they understand how to, if you will, administer the vaccination or the vaccine, no matter whether it's the Moderna and or the Pfizer, which is what we've been getting, but the logistical part of this. In other words, how do you monitor the number of people that are coming in, making sure that those that are getting the first shot are getting the second shot on time, managing, the folks that are coming here, making sure that they are part of that phasing process. So the logistics part of that being handled by our emergency management team here has done a great job, and they're going to continue to do that and work through these issues. But again, I can't stress enough how we need that support of the rest, if you will, of the folks that normally do this to be part of the solution as well, because there is going to be an incredible demand, and I think there's going to be a lot of conversation as to, okay, who is part of this essential worker, the critical workers. You got your police, fire, we know we're dealing with the EMS right now. You're going to have road workers. You're going to have people that are working from the school and the education systems. Everybody's going to say, hey, we're part of that, and we want to be looped in, and we want to go first. And I still go back to, we worried about at the onset the elderly. We found them to be most vulnerable. So, I'm leaning on this. How do we help define this statewide as being something that maybe we focus on? How do we get that vaccine to those folks first, and then allow others to be part of this? So there's still a lot of conversation. It's still foggy. There has not been a lot of direction, but phase 1B will be that critical area where we're going to see a lot more demand than I think there's going to be a supply of statewide. So we're just trying to prepare for that. We know we can administer whatever it is we're going to be getting as far as the supply. Question is, who are we going to give it to, and how is that going to be defined?
Mark, it's one of those things that as we receive clarification, whether it's through the updates from the governor's office, whether it's from statements that come out of DHHS, we will continue to advise and provide direct information through macombgov.org. So whether it's looking at schools coming back into operation and giving the leeway here as January 4th is up and running, understanding which one of those districts are in person, how we continue to guide them, looking at the opportunity to bring restaurants back to in-person dining on January the 14th, what the governor talked about too. All these steps, we'll get that information, we'll disseminate it, we'll provide advice and counsel, and most appropriately, we will connect those individuals with the appropriate regulatory agency too.
Yeah, and so we're in a better place when it comes to the numbers too. I know everybody was worried about what was going to happen during the Christmas holidays and New Year's celebrations, but the numbers are consistent around the region, and they're lower than I think what was anticipated. We're very fortunate, but it doesn't mean it's gone away, and it doesn't mean the vaccine has taken care of this issue. People still need to be mindful of CDC guidelines, and we remind people of that each and every update, and for the right reasons, because we want to make sure people are staying safe, and we want to figure out how do we finally get behind this. But again, I don't think you're going to see people telling you to stop washing hands, stop social distancing, and stop this not wearing the mask thing. I think it's still going to be part of the solution moving forward, and we're starting to see some good results as a result of that. Unfortunately, still people catching it, and unfortunately, still people dying as a result of this.
Mark, the numbers are what they are, and again, all those available at macombgov.org. It's one of those things that we're going to continue to provide the most credible information to the public so individuals can make informed decision. Whether it's individuals having conversations with their healthcare physicians about the vaccine and the impact it may have on themselves and their families and how they can position themselves appropriately, whether it's taking those protective steps, whether it's getting a business prepared, whether it's talking with our educational partners. These are conversations we're going to continue to have in the most respectful way and not be combative in any way with representatives throughout the public.
I agree. There's no reason to politicize this issue. And to JP's point, again, we've said this before, you need to start preparing, making a decision as to whether or not when that phasing comes available available to you if it's something you choose to do. And probably the best advice you're going to get is going to be from your own physician, your own doctor, and obviously having conversations with your family members no matter who you are. So that's the best advice I would take. You hear the experts talking about the safety measures. We know the FDA approved this through an expedited process, but it was still approved. They do believe, obviously, the vaccines are safe. The two that are out there so far, Moderna and the Pfizer vaccines. Others are probably coming along shortly, I would imagine. But with that being said, you need to talk to your own doctors to make these decisions, and hopefully make the right decision the time when it comes for you to go ahead and contact our health department or someone else to get the vaccine. So in the meantime, on behalf of JP and myself, we want to wish everyone a happy new year for 2021 and still continue to remind you to keep you and your family safe.